see. Can you see that?
Yes.
Okay. So there we are. This is our 15th meeting, like every 2 months. And so on this date, and as always, we go over some established agenda. And this is the agenda for today. And so, and I'm going just to pass over some of them so that because, again, we don't have, many people with us. And again, normally we have Tessie and Anelia, so who can inform us of any updates in regard to SIOP and membership and database, but I have not received any new information on that. And so I'm going just to go over this. And again, we live on this site, and there you see the connection with the link. And so we are the Global Health Network, and within the Global Health Network, we are the Supportive Care Working Group. And so this is where we live. Anyway, so they are the regional SIOPs or organizations, and within each of the organizations, there are supportive care activities. And these are just to remind us the various branches of SIOP. So these are the regional branches. And so you have SIOP Africa, SIOP Asia, SIOP Latin America, North America, Europe, and Oceania. So in regard to these branches, so we have specific activities, and here you have one of the branches is SIOP Africa, and we have Gita with us, who can update us of what is going on for the SIOP 2024. So Gita, if you want just to let us know what is going on and any opportunity for supportive care.
Dr. Kaniza, thank you so much for this opportunity to present at this meeting. Yes, we will host SIOP Africa in May 2024 in my city, which is Johannesburg in South Africa. So at the moment, we are trying to work on a program and also who we would like to invite to support us with this project. And we definitely have the support on the agenda, and we will be sending out an invitation within the next week or two. But I would just ask for you, especially you, Dr. Kaniza, to please, diarize this date. And I feel that supportive care is such an important aspect of our care. And it's something that maybe we in low and middle income countries, still have to optimize. Of course, we do not have the luxury of transference to high care units and ICU care. So I feel we need your support for the supportive care, not only with sepsis, but also the other toxicities that our patients may experience. So we are really hoping that, we will have support from you to attend our meeting and also to educate us on the better way to do things to improve the quality of life for our patients while they are undergoing treatment for these life-threatening diseases.
Well, thank you so much, Gita, and it will be an absolute honor to be there with you. And but please guide us the best way to participate in this. Seems very exciting program and meeting. Anyway, so
yeah, Kaniza, I would a little offline conversation with you. I'll send you an email about what would be the possible topics that could be, discussed, part of the education day and that thing. So I will discuss this with you and we can take it from there the collaboration going forward.
All right, I'll pay attention to that, and we'll continue the conversation like you mentioned offline, and with, because we are meeting every 2 months, so we can bring that summary of any decision conversation in this forum, so that everybody gets, on board with us as well. So thank you so much, Gita. In SIOP Asia, and I think that this is what is going on, is it right? In Armenia as we speak, because this is go from May 19th to the 21st. And again, I don't have people here with us who can tell us more about the program, but it looks like it's a very exciting program in the SIOP Asia going on in Armenia. So this is the recent meeting. This is a SLAO that it was celebrated from the 3rd to the 6th of May in Florianopolis, and I had the privilege of being there, and it was really very nice to be there. And I think everybody, would love to be there. And that was together, a SLAO together with the Brazil Society of Pediatric Oncology. And so we have a fantastic attendance. And here, basically, what we have done is, because they invited us, and so Principal Network represented in the meeting. So they gave us the morning of Friday. That is the date. So, and this program was in parallel to other program, and so we have a fantastic representation. And here you see the people who came for a speaker to give their talks. And so, in the topics that it was presented here were like new guideline in febrile neutropenia, and this is Dr. Lilian Sang, so she came to give that, and then prophylaxis, antibiotic prophylaxis in febrile neutropenic children, pros and cons, was given by Luna Vilches from Peru, and so she gave a very good review of those. And then the other one, which is the golden hour or decreasing time to antimicrobial in children with cancer and suspected infection, was a review by Claudia Pascual Morales from Peru, also who is the representative of the Pan American Health Organization in Peru. And that was followed by a discussion. And so and then and that was in the topic of febrile neutropenia. Then we have the second topic was viral infections. So the viral infections also was very interesting. So we review the overview of respiratory viruses in Latin America, and then I have the privilege of giving that. And then COVID in pediatric oncology patient was reviewed by Dr. Ivan Felipe Gutierrez Tovar from Colombia. And the respiratory syncytial virus, when and how to treat, was discussed by Dr. Juan Pablo Rodriguez Awad. And then again, that was followed by a discussion. And so then we had the third block during this symposium was about antimicrobial resistance. And the talk was antimicrobial stewardship in pediatric cancer, if this is possible, again, given by Dr. Ivan Felipe Gutierrez from Colombia. And there he shared one of the projects that he's conducting in this topic in his hospital. Then we talk about multi-drug resistant pathogen, the therapy, monotherapy and combined therapy, and that was led by Dr. Jeffrey Ryback from the United States. And he gave a very nice overview of what is going on with the therapy for these pathogens. And then we discuss a clinical case of multi-drug resistant pathogen, and then overall discussion. And then the last one was about fungal infection, epidemiology of invasive fungal diseases in Latin America by Dr. Fabian Carlesi, and then new antifungals by Dr. Jeffrey Ryback, and then a discussion of the clinical case by Fabian. and then the overall discussion. And so these are the topics discussed in infectious diseases for the SLAUB in Brazil. The SLAUB is the Latin American branch of SIOP. Anyway, so and again, this is a something that we have done, and this is for Gita. So some ideas, and it was very well received. These topics. Not sure if there is any question about this. Could you hear me? Hello?
Miguel, I can hear you.
Oh, okay, okay.
I can hear you, Dr. Caniza.
Okay, and again, those are the topics that we presented for the SIOP Latin America, okay? And again, Gita, those are ideas, and again, if you want, I can provide you these ideas, and so you can build for the SIOP Africa.
Yes, thank you, Dr. Caniza. If you could just email me this list, and I will go through them, and then I will be in touch with you.
Okay, fantastic.
Thank you so much.
Mm-hmm. And again, this is just to remind us of our friends, the Supportive Care Network. And remember, because sometimes people confuses the Supportive Care Working Group of the Global Health versus the Supportive Care Network of the SIOP. And there you have Reggie and other member of this group. And again, normally she's very enthusiastic about collaborating with us. And of course, just to remind people about the Congress, the 55th Congress of the International Society of Pediatric Oncology in Ottawa, and that is going to be October 11th to the 14th. And it is amazing. You can see already a fantastic place awaiting us, and I hope that you are preparing to go there. And so these are some of the program highlights, and I really encourage all of you just to check into that and see the opportunities that are there to network, to participate, and I'm sure that you have abstract, you have some other more direct engagement with this network. And then what we have for that is it was given to our working group, this topic, managing existing and future endemic and pandemic diseases in children with cancer symposium. And that is, of course, organized by our working group and is supported by the My Child Matter. And the chair of the symposia is Dr. Guillermo Chantada. And so this is the time that we are going to be providing this symposia, and so in the distribution of the themes. An intro, the topic 1, Dr. Nita Radhakrishnan is talking about tuberculosis and comparing the experience tuberculosis in pediatric cancer in India and South Africa. And again, for that, we have a meeting between Dr. Radhakrishnan and Dr. Nadu, and where Gita was very kind and provided her a lot of information of previous studies done in tuberculosis. So, and Dr. Anita is working on this, and we are just awaiting more information from her to see how this project is going on. And thank you again, Gita, for your availability and your guidance in how we can do this. And then also, since you provided the important, how to conduct this study. And so as soon as we got more information from Nita, we are going to be sharing more in this forum. So then Dr. Rijadi Adrisain, he is conducting the study of dengue, the effect of dengue in pediatric oncology in these countries. And also he finalized the building of the data collection form, and he's going to be collecting information on this topic and with from countries listed here. And so also the group submitted a abstract for for presenting a poster for the meeting, and so we are awaiting the result of that. The topic 3 is going to be about multi-drug resistant pathogen and issues in caring for children with cancer. I put here the details of 2 centers, St. Jude and then another center in Egypt. And so following by question and answer and the conclusion. I'm not sure if somebody, and I'm not seeing if any hands are raised. And I see there are 7 participants. So I'm not sure if people has any question about this. Okay. And again, please open your microphone. Just ask me if you have any question. So those are in regard to meetings, and now we are going to give some progress update of ongoing activities and projects. And this is overall the overall grid that we follow in our working group. There are categories like in education, research, resource identification and connection, and the various areas of engagement: infection care and infection prevention, blood safety, holistic care, oncologic emergency, and others. So, and I'm going just to review each of the major one in each of these groups. So in rehabilitation task force, and I don't see if Abu or Pia or Annie Brochure is there. Please just open your microphone, but I did not see them. And so I'm going just to pass over this. But Sergio is here. And Sergio, certainly he has very exciting progress to report. And I'm going just to go ahead and open a presentation that he provided us so he can share with us what happened with the transfusion medicine project. Are you there, Sergio? Okay, so I'm going just to go ahead and open your presentation. Can you talk, Sergio? Sergio, can you talk? So if you're trying to talk, we cannot hear you.
I see that he joined 2 times.
Yes.
Sergio, can you hear us? Maybe.
Can you hear me?
Yes, we can hear you now.
Oh, perfect. It was always so stressful, this. Okay. If you have my presentation.
Yes, just 1 second, Sergio. Okay, this is what I have, transfusion medicine.
Yes. This is the slides I sent you early today, isn't it?
Yeah. Mm-hmm.
Okay. So as you might remember, we have discussed before our project is to assess the educational needs of blood product usage in pediatric hematology centers among SIOP members. The next one, please. So before we had discussed something about we wanted to know which was the problem to identify and to address the general needs and necessities in another centers. So now we are in the 3rd part of the project. We have developed the next one, please. SRV in order to assess which are the most important problems that we have to face. The first one, please. The next one. Okay. Next one, please. Okay. As we all know, the WHO states that this is a kind of review. We have discussed this before, but I just wanted to review in general what we need. And as you know, as we all know, transfusion procedures in place this delicate process in quality uses. And also, transfusions, when it's inappropriate and it's not well indicated, we all know that may compromise patient safety. So we think that healthcare workers can receive a better training in order to assess those risks, the benefits, and to describe more properly the indications. Next one, please. So the objective of this project is to provide those care providers tools to understand all possible risk and to improve management and also to manage side effects and recognize, of course, the state-of-the-art indications. We know that there are gaps of knowledge and we want to address those gaps in order to delineate better practices. The next one, please. So, next one. So, we developed a well-organized survey with different sections. For instance, in the section A, we are addressing 3 questions regarding institution characteristics, type of practitioner, and type of center. Next one, please. Then section V deals with legislations, national and local legislations, resources, and knowledge and development of local guidelines. Next one. These are in 23 questions. Section C deals with indications and side effects. These are, in general, the survey has 40, we have discussed this before, to 40 questions. So in the last part, this is the start of the art indication, the knowledge of special components, which is the management for side effects and error management. The next one, please. The next one. So what we had already, we have exposed this project to the ethical committee, and they are dealing with that. This is in a local hospital here in Argentina. We are working with that. And the second is we already sent in a Spanish form of this questionnaire to different places, different centers, and we have already analyzed, it's an overview, 12 respondents, 12 health work professionals that have responded already, and we have some data about that. The next one, please. This is our survey piloting result as a way to know if this survey works or not, and which are the nodes that should be improved or perhaps reassessed. Next one. 12 participants have already answered, and regarding, for instance, the position, in general, there were hemato-oncologists, 2 nurses answered. In general, we see that both public and private center in 5 out of the 12 respondents. In the years of graduation, more of the respondents were more than 10 years after graduation, and they prescribed frequently blood products. In general, they were aware, half of them, seven respondents, have some awareness of legislations in their country. And we have some heterogeneity concerning the disease screening of the blood product. As you can see here, some of them responded just 5 screening, another ones 4, and the other 6. So they don't know exactly which germs and infectious diseases are screened in the blood product. This is it's a huge heterogeneity. The first one. The donor profile in general is in Latin America in terms of reposition and altruist, both of them. It was it was for me at least amazing that in one center they still use whole blood, and two respondents say that they don't know if they were used or not whole blood. They also say that in 8 centers they have the committee available, the blood committee available, and they all say that they had methods in their centers regarding quality assurance. They say also that sometimes, in 2 responses, say that sometimes they receive some kind of training regarding indication and blood products, and they said that in general, the doctor or the health professional who deals with the transfusion, sometimes they check when they see the product, the type and screening of blood type. It was never in 7 patients, so they don't see what's going on there. And also the informed consent is not signed before blood transfusion in 7 centers. They never sign any informed consent. So it was something that for me was revealing. So who participates in blood indication, who deals with the discussion about indication. And they say that in general, the clinician and hematologists, they are the only ones that discuss indications. Nurses and the other health providers are not involved. In general, the technician hands the blood to the patients, and in 2 responses say that the nurse did. Doctors are not involved with this procedure. The next one. The nurse in general controls and assess any reaction of the transfusion, and in general, when they want to ascertain the identification, we have a problem with identification of the patient and blood in Latin America. They said that most of them rely asking the parents or to the guardian of the patient the name of the patient in order to deliver the blood transfusion. Just in 1 center they have a barcode. They don't know it in 3. They just don't answer the identification in 1 center. So when we ask about measures, what they do about adverse events, 4 centers say that they don't know what measures are available to deliver in a case of an adverse event. And when we ask about the measures to prevent adverse events, they said that in general they are all reported but not punitive, and in 3 centers they have educational series for that, and in 2 centers there's nothing. So the Coombs direct positive test was available, of course, in all the centers. And we asked also about granulocyte transfusions, and in 3 centers they just didn't know if they had this facility in their centers, and they said yes in 2 centers and no availability in 2 centers. The transplant was performed in 8 out of 12 centers, and they said that they didn't know if they had a specific transfusion protocol for stem cell transplantation patients. They didn't know in 3 of the centers, and they knew they had something in 5 and nothing in 4. The next, please. So we asked about traceability, and they said they could trace the donors in a case of an event in 9 centers, but they couldn't, or they just didn't know in 3 centers. And when we asked the most common blood products available, 12 centers responded they have everything, and special product, which is filtered blood products and irradiated blood product, they had in all the centers. And we also asked about the cell dose that they prescribed, for instance, for red blood cells, And in general, the dose is okay. In 9 respondents say that 10 to 20 milliliters per kilograms were described. 3 respondents were not sure. About the volume, they say that in general, they respect the volume of red blood in each transfusion, or sometimes in 3 or almost always in 2. When we asked, and this is what was also very revealing, about filtered product, even though they prescribe filtered products, we asked why they prescribe filtered product, and the answers were they vary a lot. For instance, sometimes some respondents said that was for prevention of transfusion GVHD. It was in 5, which is the correct answer. Another one said that it was for prevention of febrile reactions after transfusion GVHD, and another one said that it was for prevention of hemolysis or hemolysis and febrile reaction. Another one said that it was intended to prevent CMV infections or just hemolysis. So the answers were quite different and heterogeneous. So when we asked also about why they were irradiated, they said that it was for prevention of hemolysis in 2 or hemolysis and GVHD in 1. The first one. The next one, please. So when we asked, this is the last one, when we asked about when platelets were indicated, and we wanted to know if they were indicated according to, with bleeding or just the level of platelets, and most of the respondents answered that in 2 cases, which is okay. So after that, we wanted to know which level platelets were indicated, and most of the respondents say that it was between 20 and 30,000. 4 said another levels, and 1 said that less than 10,000. When we wanted to know if platelets are indicated according to bleeding symptoms or level of platelets, they said that in general it was the guideline. We wanted to know the level of the level of platelet for Lambert punctures, a diagnosis of ALL, and in general, most of the respondents, all of them said that it was around 50,000 or more. The same for surgery. 8 responded more than 5,000, and 4 respondents said that they transfused platelets with more than 20,000. We wanted to know, we sent different indications for granulocyte transfusions, and 8 of the respondents didn't answer, and 4 said that the right answer for indication in case they had this form of transfusion available. So we asked about their confidence about management of transfusion reaction, and they say most of the respondents say that they were very confident, but 5 say that almost always. So there must have some gap that perhaps we have to take more information in detail. And we asked about anti-allergics, when were they prescribed, or if they have, for example, reaction allergy, and they said that in general, after the first allergic reaction, they indicated Benadryl, which is antihistaminics, and hydrocortisone, both of them in general. And after that, we wanted to know if they considered TRALI as a possibility. We wanted to know if they knew what TRALI was, and they said that sometimes they considered TRALI, never, because they didn't know what it was, 2 patients, and almost always 4 of them. So this is the first piloting of what we did. Okay.
Well, thank you so much, Sergio. And I don't know if if any of you have a question for Sergio. And remember, this was a pilot. Sergio was checking how well performed the questionnaire that it was built, and that was run in Spanish. So Sergio translated that in English. So I'm not sure if you have any question for Sergio. Well, yeah, go ahead. Go ahead. This is me. So, Sergio, you were mentioning that some question that it was a little bit, how can I say, like you want to improve some question. Can you comment on those questions that you would like to improve?
Yes, this is a perception that I had, because when I review, it was it's a perception. I don't have clues for that, and I noticed that in general nurses are less. Two nurses answered, but it was a huge gap between knowledge about nurses and the rest of healthcare providers. So I would like to ask in detail to nurses, because what I realized is that they need more information. And for instance, when I asked about Trali, I felt that perhaps doctor felt pushed to answer the right question. So perhaps we have to change a little bit, not in order to test knowledge, but to feel confident about answers. I don't know if I'm clear. I don't want them to feel as they are exposed to a test because they feel pushed to answer the right way. So this is the only thing that I noticed when I analyzed the data. But still, it's a piloting.
Yes, and I think that is fantastic. And you know, since we are going to be the plan is to present this to the SIOP board to review that, because we want to have the member of SIOP to answer. So I think that is a very good idea. You know, since you identify already an area that you want to kind of like investigate a little bit more, and that will be in the nursing group. And so that is fantastic. And so I guess that the next time when you tell us about that, let us know, you know, how you are planning to further investigate the knowledge among nurses.
Yes, this is a plan that we have to build. Perhaps the question should be easier to respond, and perhaps we have to deliver. You know, in general, nurses in Latin America are not involved in the process of decision making. In general, they do what doctors order, and we can see this in this piloting, because it seems to me that they are not involved when a transfusion is indicated. They're just not involved. So it could be very important for us if we can do something about that.
So are you thinking, Sergio, like so they identify if they are nurses or physicians, and there are some questions that is going to be more for physicians than nurses, since physicians are the one who indicate, because it could be that it might not be fair for nurses to ask them question a lot, and especially if they are not ordering, but kind of like more asking the nurses more question about side effects of the blood transfusion. So is that something that you're thinking about?
Yes, I'm thinking about that, and perhaps I think that after that we have to deliver, because in CEOP, for instance, I don't know if we are going to deal with nurses in CEOP with this, but perhaps as they are nurses, they're responsible for delivering the blood product, they should be very, very well trained, because as you know, we have a lot of side effects. But it seems to me that they are not well trained in that. Doctors don't have the whole information, but in general, they have good information. But the gap with nurses in Latin America at least, or my country, is huge. So perhaps, Miguela, we have to think something more designed for them, perhaps in an easier way to understand, or I don't know, simple questions in order to know exactly how the panorama is.
What we could do is we can intersect with the nursing network. And again, we can talk with Courtney Sullivan, and I think she's in charge of the nursing in SIOP. And so
Okay.
she would be really nice to review that, having in mind, you know, the nursing group. What area do she think, meaning like we can ask Courtney if, you know, what question would be appropriate for nurses. And I think that this is an excellent idea. And again, we can send that to Courtney Sullivan. So because she is, she's one of the leader in the nursing network, and we can send that to her.
Perhaps. I think it's perfect if we could do that, because for us it's our area that is very important in blood products, because for instance the identification is done by nurses, sometimes technicians, but doctors are not involved. As you see there, they don't have barcodes, so they ask, what's the name of the patient? Jean. Okay, this is Jean, so the blood goes to Jean. So, and this process is related with nurses. So that's why it's so important, I think.
Yeah. And again, we have Gita there. I wanted to know Gita's opinion about this survey, and in what way this is going to be helpful. And Eustace also is there. Any thought, Gita? And again, I don't know if she's listening to us. And also Eustace, I know that you are you're a pharmacist, is that right, Eustace? Can you open your microphone and let us know? Are you dealing with a blood transfusion, Eustace? Anyway, so we cannot hear you. If you're talking, we cannot hear you. And I'm not sure if this is my problem here, because sometimes I have problem with the connection. But all right. So any other thing? And again, I don't know why, if they cannot hear me, or there is an issue with the microphone. So Sergio, so thank you very much for this presentation. And the good part is that this presentation is being recorded, and so that for people to access. And this is a fantastic preparation for a larger study. And I think that you identify very important issues that we can work a little bit more. And so happy to, and we can talk offline how we can send this to Courtney Sullivan, who direct the nursing part. All right.
Okay.
So thank you again. And I know that we are getting to the, to the top of the hour. And so if there is nothing else,